From London, I'm Rochelle Travers, and this is The Standard. It's one of the most emotive subjects in UK politics, the NHS.
Every single winter, we talk about the winter crisis in A&E departments, but now we're seeing that spread into summer. We're seeing patients wait up to 12 hours and beyond for emergency treatment.
When do we want it? Now! How do we get it?
Unless we take action, we've got absolutely no chance of restoring doctors' pay, keeping staff in the NHS and making our service decent again for patients.
And that is our plan for 40,000 extra appointments each and every week to get the waiting list down. That will be 2 million off the waiting list.
We'd be able to say to people and get a legal right that people could see a GP within 7 days or within 24 hours if it was an emergency.
I am in this to make sure all of you get the healthcare that you need. I love the NHS. I'm from an NHS family. My dad was a GP, my mum was a pharmacist, and I've worked incredibly hard to get the waiting list down.
This week, in the run-up to Election Day, we're taking a deeper look at three of the biggest issues for voters: taxes on the economy, immigration, and today it's the turn of the NHS. Strikes, waiting lists, lack of funding, not enough GP appointments, dentist appointments, or mental health services. They're all issues that never seem to be out of the news. Experts have been sounding the alarm that the NHS is in crisis for years now. So what will whoever wins the general election and makes up the new government do to improve the situation for our much-loved healthcare system? To look into this subject in more detail, I'm now joined by The Standard's health reporter, Daniel Keane. Daniel, how would you describe the current state of the NHS?
The NHS is in a pretty bad state. People that work in it will tell you that the past 3 years have been the worst years of their professional careers. We've had record waits for ambulances. We've had a waiting list for treatment that has ballooned since the COVID pandemic. And other key services like dentistry and mental health have all reached a state of crisis. What you hear from voters ahead of this election is that they can't see their GP, they can't see their dentist, and that if they've been to A&E, they're waiting for hours. And all of that means that fixing the NHS has to be a priority for the incoming government.
What would you say are the key issues that matter to voters when it comes to the NHS?
I think that one of the key issues for voters will be access to the NHS and the ease at which they're able to access NHS services. GPs are often called the front door to the NHS, and they're the most important kind of aspect of the NHS for voters in some senses. And when people can't see a GP, they feel as if the NHS is dysfunctional. And that's why we've had so much focus on primary care from both Labour and the Conservatives. So I think one of the main things that either party, should they win, will look to do is to improve waiting times. We've had a decline in the number of people who are able to see a GP on the same day. And the number of 4-week waits has jumped quite dramatically in some regions in England. So that will be one key thing. Another key ask will be bringing down the waiting list. So reducing the waiting list was one of the pledges made by Rishi Sunak when he set out his 5 key priorities for government last year. But actually, figures show that around 1 in 9 Britons were waiting for NHS treatment at the end of February. So that's a huge amount of people. Labour or the Conservatives, should they win a shot victory, will really have to bring this down methodically. And that will involve resolving industrial disputes and also making sure that the NHS has the capacity to be able to bring this waiting list down, and that will require extra technology and investment.
We have to talk about strikes. We've just had the junior doctor strikes over the weekend, and there's been countless others over recent years from different parts of the NHS. How urgent is it for the next government to get a grip on this issue?
I think it matters a great deal. The latest NHS figures show that we've had around 1.5 million appointments postponed since industrial action began in December 2022, and it's still ongoing. So we've had nearly 2 years of strikes, which is quite something. And that includes not just the junior doctor strike. There was a strike by consultants, paramedics, physiotherapists, nurses, of course. So a huge wave of discontent and anger sweeping across the NHS workforce. I think that the junior doctor strikes will have to be resolved very quickly for the next government to be able to bring down waiting times every time there is a strike, hospitals and NHS trusts have to cancel all of their elective procedures and essentially operate on a kind of Christmas Day level of service, meaning that only patients with an emergency can get treatment. It's simply not sustainable for a union to strike every month and for waiting lists to come down. But what's also important to stress is that waiting lists were going up prior to any of these strikes. And that is a key issue for the government, and kind of untangling that quite complex mess will certainly be a challenge.
Dentists is another one where no one can seem to get an appointment anymore. How bad is the situation currently?
Absolutely. So dentistry is also in a really poor state, and we've seen a huge rise in hospital admissions linked to children due to cavities and essentially like a lack of proper oral hygiene in their early years. And that's something that for a very wealthy country, is pretty shocking. Labour have drawn up their dentistry rescue plan, and that includes an extra 700,000 urgent and emergency dental appointments a year. And what they're also trying to do is entice new dentistry graduates to work in areas that are underserved. So those graduates would receive what they call a golden hello of £20,000 to work in those areas for at least 3 years. Another important policy they've announced is supervised toothbrushing, which people initially laughed at, but is a big issue for young children. So 3 to 5 year olds in school will be supervised when they brush their teeth at school. One of the huge issues for dentistry is this kind of slightly fudged system we've got where practices are not kind of bound or legally to provide NHS services. And given that there is a shortage of dentists and of dental staff, it's much easier and more lucrative to take on private patients. Basically, until we start to provide more capacity, patients will continue to be turned away. You also have the issue of dental deserts. So many regions, particularly in the southwest or rural areas where there just isn't an NHS dentist. And unfortunately, it's led to people giving up. And we've seen reports of DIY dentistry, people pulling their own teeth out.
Mental health is an area of the NHS which is also struggling a lot. Are any of the political parties promising to tackle this issue?
Mental health services are in a really dire state, and Sir Keir Starmer and Labour have repeatedly emphasised that they need to get better because good mental health is key to creating a more equal society. So what Starmer and Labour have said is they'll commit to funding an extra 8,500 new mental health staff for the NHS because there's serious shortages in many areas. And they've also promised that children will have access to a specialist mental health professional at school because they argue this is the best place for children to be receiving support. They also want to open these early intervention hubs for children aged between 11 all the way up to 24, actually. And they say they're going to pay for this by closing tax loopholes. The Conservatives' record on mental health is not great. It has not been a priority for the Tories in the past 5 to 6 years. It was noted that there was very little mention of it in their manifesto. And I think for the Conservatives, the waiting list and GPs are the kind of key targets. But mental health services have declined under their leadership. And it is definitely a kind of policy area that they've lacked ingenuity in.
Let's go to the ads. Coming up in part 2.
The NHS matters hugely to voters. It's been consistently in the top 3 policy areas identified with voters in different polls.
The Standard podcast will be back in just a moment. Welcome back. Let's talk NHS funding now. What are the different parties saying when it comes to this?
The amount that is spent on health is frequently a topic of debate. In 2022 and 2023, the Department for Health spent about £182 billion on the NHS, and that's used to fund everything from GPs to ambulances to mental health services. One of the difficulties for Labour is that they have pledged to reform the NHS and to kind of overhaul it and get these waiting lists down. But there isn't actually any new money. They've not promised to raise funds from tax or any other sources. So it remains to be seen whether Shadow Health Secretary Wes Streeting will be able to deliver genuine change without the extra money that's needed. Because at the current level, I think most NHS bosses would tell you that the funding isn't sufficient. There are simply too many parts of the NHS that are broken and in bad condition to go without significant extra funding. Labour could make the argument that tax rises could be used to fund a better NHS, but they've not made that argument. They've essentially told people taxes won't go up and public services will improve because we'll reform them to become more efficient. So the question of the NHS budget will certainly be on their mind.
Is there anything else that any of the political parties are promising that could help improve the situation with the NHS?
So the Liberal Democrats are really keen to highlight the poor state of NHS infrastructure. And that's something that anyone who's visited certain hospitals in the UK and in London, like Hillingdon Hospital, will notice. It's impossible to deliver good care in hospitals that are literally crumbling down. So what the Lib Dems have pledged to do is spend £1 billion a year on repairing these hospitals. And they say that millions of people would be treated in hospitals that are affected by this dangerous reinforced autoclaved aerated concrete, which is RAAC. And that if this continues to happen, then patients will be put at risk. So basically what they're saying is this kind of capital spending on infrastructure has to go up. And if these RAAC buildings are allowed to continue to house patients, that will have kind of operations cancelled due to a leaking roof, and that patients could be put at risk by mold, all of these issues. So the Lib Dems are really coming out front and centre on this issue, and it's not something we've heard a huge amount on from Labour or the Conservatives.
And finally, how much does the NHS matter for voters?
The NHS matters hugely to voters. It's been consistently in the top 3 policy areas identified with voters in different polls. And it has been ever since the pandemic. And I think that the pandemic reminded people just how vital the strength of the NHS is. What we've seen in polling is that people want the NHS to remain, the same. They want it to be free at the point of use. They want it to continue to deliver all kinds of services, but that it needs more money. And I think that is going to be the challenge for the next government, is delivering more funding, but more efficiency, because the NHS already has a huge budget and the Treasury will be loath to provide, more money for a service that is not providing a good enough care for patients. I think that any party that is able to meaningfully make changes and improve the NHS will find themselves reaping the benefits electorally.
You can find out more about the general election and the NHS in the Standard newspaper or on our website, standard.co.uk. And that's it from this episode. This podcast will be back tomorrow at 4 p.m.